Hi, welcome to the Elevating Aesthetics podcast. I'm your host, Megan Theus,
And I'm your host, Brittany Perez.
and today we're here with our girl, Jamie Walls.
Hi there. I recently moved to Pensacola about 2.5 years ago. I'm an esthetician at Mila. Been with them for about a year. I absolutely love it. I love French Bulldogs and Dr. Pepper Zero.
Yes, she does.
She does. I still them sometimes. I want to talk about things that are trending in aesthetics right now. One of those being azelaic acid. I keep seeing it on TikTok over and over again. So I wanted to pick your brain about if you've used it before and what your thoughts are.
I've used it when it's been in certain products and stuff, and it's good for acne, inflammatory skin, rosacea, stuff like that.
Yeah. So I've had patients actually reach out to me. I had one reach out yesterday and she was like, "Hey, what is this about azelaic acid?" And it's something that I typically prescribe for rosacea.
Hmm.
Azelaic acid is going to be anti-inflammatory and it can also help like reduce pigmentation. Have you had any patients reach out to you?
I have not, but I have seen it all over my FYP. And I'm like you, I have used it in skincare products that are mixed with other ingredients, but not just by itself as a standalone.
I just think that people, when they see things on TikTok, they automatically think like that's, one size fits all. Like, I need to use it. I need that. I need that. And then they usually end up with their skin looking worse than before.
Yeah, like damaging their skin barrier. Do you think with azelaic acid, it is such a gentle exfoliant that it really could be used for any person or any age? Or do you think there's any?
Yeah, I mean, I think so. I mean, depending on how they're using it and, how much they're using it.
Yeah.
Because it is so gentle, it'd be pretty good for, most skin, especially like teenagers starting out where they don't want to go that huge harsh route.
Yeah, and maybe if they have, like, post-inflammatory hyperpigmentation from
Mhm.
acne, maybe
Mhm.
that would be good.
Yeah.
Over the counter, you can get up to 10%, and then anything above that, we've prescribed. So I believe Finacea starts at 15% and goes up to
Mhm.
20%. So what I would typically tell patients is to start with an over-the-counter version and use it once a day, and then if they're
Mhm.
tolerating that, increase it to twice a day, and then, they can move up to a
Right.
prescription strength. But I think it's really good for all skin
Mhm.
types as well. It's an ingredient that I personally haven't used yet, so I'm actually gonna
Yeah.
call it in for myself. We're not calling my testosterone.
Yeah.
It's funny because we literally talk about this a lot in my clinic, but at home treatments have become so popular because of TikTok. And while I love TikTok and it's been so great, we were just joking about how businesses that have been around for a long time are now like super busy because they became like TikTok famous and
Right.
like just being out in the public eye, it has brought so much attention to places. But on the flip side of that, there's a lot of like DIY on TikTok. And some of those things really aren't something you should be doing on yourself at home. You know, Botox, filler. We've talked about that on our podcast before. So, what are your thoughts? I mean, I know with microneedling, it's a little bit different because that's not as dangerous as, say, losing your vision or having a necrotic lip from doing your own filler.
Still just as dangerous because if the people aren't cleaning, whether they're using a skin pen version of something they bought off Amazon, or if they're using a roller and they're not properly disinfecting it, it can cause infection. Rolling it over, a bazillion times, you're creating more than just a microchannel. You're, creating damage. It could be, whether it be hypopigmentation, hyperpigmentation. So a
Yeah.
lot of those things, chemical peels, people are doing chemical peels at home, burning their stuff, like they're seeing a
Permanent scars.
Yeah. So crazy. And what if they like already had underlying? I mean, we all have some sort of like MRSA underlying, over the years. What if they have an infection they don't know about and then they microneedle and then their whole face is covered?
Mhm.
It's just
Yeah,
really
Well,
wild.
especially if they have, have to take like Valtrex and stuff like that. If they don't know that they need to take it and they get cold sores, and then, they could have a
that's a
huge
great point.
outbreak.
That's true with at-home filler too that I bet people don't
Mhm.
think about. The other thing with microneedling that people do not realize is that most products are not intended to go past that superficial epidermal layer.
Mhm.
And what they're doing is they're opening the channels and they're putting in random hyaluronic acids or serums, and they're causing granulomas or permanent
Yeah.
scars in the tissue. And so while yes, the procedure itself is simple, the reason that we do them in a trained clinic is because you don't know what you don't know.
Yeah.
And that's the reality of this
And
thing.
I've even seen people, buying these like at home laser machines and IPL machines. And it's like, you have no idea what you're doing and you're going to cause more damage than needed be. So it's like,
Like as injectors, I mean, Brit's to a place where she'll, inject herself. She's been doing this, 15 years. I don't even do my own Botox. I get on to her all the time. I'm, stop, I'll inject you. But when I see people just because you can doesn't mean you should. And being a registered nurse or whatnot does not make you qualified to be an injector. I was a registered nurse for a long time before I went back to NP school, and I felt like a green provider in the aesthetic space because, yeah, you can learn anatomy, but that doesn't mean you understand the rheology of the product. That doesn't mean you understand, all the risk associated with it. And while it looks easy, and I joke with my medical assistant, I'm like, "Do you feel like you can do this on yourself because you watch me all day?" She's like, "Mm-mm."
I've seen, other estheticians on these aesthetic pages, like some in Texas and stuff that are like, got these back rooms where they're injecting Botox and they're injecting filler and they just have, a state license, as an esthetician. Like, no, there's a
Lash
reason.
artist.
Yeah, there's a reason why you go to school.
And there's regulations. And the
Mhm.
other reality is, I bet if we sent these products off, they would have a higher contamination
Oh,
risk.
absolutely.
And they, a lot of times, are not the product that's advertised because they're not regulated. And
Mhm.
the reason that companies spend, $500 on a syringe of product to resell instead of $30 is because it's going through FDA regulations, it's going through sterilization, there's so many checks and balances that you're not getting when you're buying tox off the black
Mhm.
market. It's a very high risk procedure.
So what are your thoughts of people buying, lidocaine off of Amazon?
Now, I'm not familiar with that.
Mhm.
It depends on if it's coming from a medical distributor because I know there's like an Amazon
Mhm.
medical part of it, but I know for sure they don't sell Botox and filler on there. That's something actually that's a great question. I'm not familiar with that. You mean like topical lidocaine?
Yeah, like topical lidocaine, like
To be able to do their own
yeah.
microneedling and things
Yeah,
like
that's a
that.
good
Yeah.
question.
Because where else are they gonna get it? And then the other side of
They
it.
might not know that it's toxic and they can
Right. And then the difficult thing for us as providers and injectors is we don't want to take on the liability of correcting an issue whenever it goes wrong at home. And you're doing DIY and you've done this, you say you give yourself a vascular occlusion. We don't know what the product is. So,
mm,
we are taking on a risk to be able to bring you in there and correct it that I'm not willing to take because
yeah,
that's
that's
my
it.
license on the
Mhm.
line.
Yeah, because if a small part of the filler breaks off, you can
Mhm.
actually cause an ingress to another
Yeah.
area. So it's just a lot of consideration.
Yeah. And
And what you're talking about with the lidocaine is actually a valid point as well, because people don't realize that even if you're not injecting a lidocaine, the topical lidocaine is taken up systemically, and there have been deaths
Mhm.
from toxicity
recent.
from topical lidocaine, from putting on too much topical lidocaine because your skin's your biggest organ.
Mhm.
And so people are thinking, oh, I'm just putting on a lotion, but that's not true. It's being taken up in your system.
Mhm.
And what if you have an allergy to it and you don't know and you're at home alone? It's just so many factors.
That's actually one of the reasons we have the protocols in place at Mila for our medical assistants and our estheticians. They can only apply so much product because anything can happen. And
Mhm.
there's such a risk that we take, especially for people or patients that are getting lasers on multiple areas of the body. Like you're talking about them in face, neck, and chest. What if they're getting their hands done? Like that's a lot of
It
lidocaine.
is.
It is. It is, and it depends on your body weight, so
Mhm.
and how much your kidneys can filter.
Yeah.
What about red light therapy?
I think it's good, but I think the amount of red light therapy that you would need on a daily basis based on, like, the wattage and stuff like that, like, you would have to spend, like, 22 hours underneath the lamp.
You're in a lamp all day.
Yeah,
For the
like,
spinning.
just make my cubicle red light
That
therapy.
would actually be cool. Maybe my office should be
Yeah.
a red light booth.
They should have some red lights in our rooms or
It
something.
they definitely have benefits, but I think that, everybody's got these red light. I mean, I'm built to have one too,
Yeah,
fast at home, and I think it's great, but I think the amount of time and hours it would have to work to actually see the huge benefits of it or
it takes consistency. I know some research has shown that you need to wear it 5 days a week for at least 20 minutes a day, and it
Mhm.
needs to be over 800 wattage. And I actually got my husband, it's a ball cap. It looks just like a ball
Okay.
cap because his hair was starting to thin, but we're using it in combination with other modalities
Mhm.
like hair microneedling, the plated hair serum, and the red light therapy. I don't know that it's a great standalone treatment. Like, you're not just going to put a red light mask on and not need other modalities like microneedling or
Right.
Botox or fillers. I think, that it might be good in conjunction with other things for something that is very safe.
Yes.
It's so hard because there are so many things that you see on social media, and I don't like to say like, "Oh, it's a gimmick," but sometimes there's a lot of
Yeah.
gimmicky things, and people will give their money, honey.
What's your number one gimmick that you've seen? Because I
The
have
ick,
one.
like, what do you get
Yeah.
the ick with?
Um, like, just in
Just
general,
seeing, like, online or on TikTok or something like that. Have
people
you
use an apricot scrub.
the St. Eyes?
Okay, I was a St. Ives girly in high school because I
Me
didn't
too.
know any better. I'm
Yeah.
like, "Oh, this is gritty. This is getting
Yeah.
all the skin cells."
The dead skin and the alive
Yeah.
skin.
Yeah.
I have no skin barrier now.
Mine is the cellulite product.
Oh, yes.
Those drive me crazy. They'll have like a cream that they're rubbing on the back of their legs, and they'll be like 1 week later, and it's like all these dimples, and then all of a sudden it's like this smooth leg, like a 10-year-old.
Oh my
Just
gosh.
race.
Yeah,
Like,
yeah. What about you? Do you have one?
Honestly, like, cool sculpting is kind of gimmicky to
yeah.
me because while it works immediately after and people look great, like, that is not really killing off the fat. It's
Yeah.
not
I
liposuction, and
agree.
I think that people spend thousands of dollars. I've personally had patients that have spent thousands of
Oh, yeah.
dollars,
Like 10,000.
$10,000 on cool sculpting, and for what? Like,
Yeah.
the fat is still there. You need liposuction, and you could have just had a lipo BBL with that money.
It's less expensive. Like, I used to tell
Yes.
patients that when I worked in plastics was it is actually usually half the price to get liposuction. Now, there is more risk. There are tiny little scars and you do have to wear compression, but it's a one and done. It's less expensive and it is going to work.
Yeah.
And so I do totally agree with you on that. That's
Mhm.
really
Yeah,
good.
that is
That
that's
is a good
that's
one.
well, we love Jamie. She is like a jack of all trades for us. She does so many
Yeah.
things around the office. We're so happy that you were able to hang out with us on the
Yeah.
podcast
Thanks
today.
for
And if
having
you
me.
come into Mila, make sure you say hi to Jamie. You'll see her at the front doing some things. She's an amazing massage. Like, we call her the massage girl because she will give you a facial that
Yeah,
puts you in
matter
a
of fact.
trance. She got Addison twice today. It's
I did.
so if you're looking for a really great esthetician, you want to get put in a trance, that's your girl.
Thank you so much for
Thanks.
coming and thank you for listening. We'll see you next time.